Okay, my dear friends, today's topic is again another one related with the excretory system, and this is the types of the bladder. Slide number 1, you are seeing my name, Professor Deshpande. I am MD in Ayurvedic Medicine and MD Ayurvedic Physiology. But the main concern is with this types of the bladder. Slide number 2. Slide number 2, types of the bladder. Atonic bladder, atomatic bladder, and uninhibited neurogenic bladder. Again I am telling you, this is also a part and parcel of the syllabus related with the excretory system. And excretory system is concerned with the kidney, ureter, bladder and urethra. In the last video we have seen the micturition reflex, and this is related with the bladder. In the micturition reflex you have understood detrusor muscle. There is a muscle in the urinary bladder which is a contractile muscle, and whenever the bladder is full, it giving signal to the spinal cord, and spinal cord is giving the motor nerve stimulation to the internal sphincter as well as the external sphincter. Now this micturition reflex, these all the steps, sometimes they are not followed in some people, some patient or some person. And these people, these patient, why they cannot do this micturition reflex normally? Because they have a lot of problems in their bladder. And the simple problem in their bladder is not working physiologically. You have already understood what is physiologically. Their detrusor muscle is weak because of the old age, because of the trauma, because of the injury, because of the road accident. So whenever your lumbar, vertebral, these all the area is get damaged because of the fracture, because of the accident, because of the trauma, because of some disease also. For example, you are getting repeatedly inflammation of urinary bladder. Whenever there is inflammation, anybody is remembering what is the suffix of the word? Suffix, yes please. Correct. I, T, A, S. Whenever these 4 letters come at the end, ITIS is indicating the inflammation. Tonsillitis, inflammation of tonsil. Bronchitis, inflammation of the bronchi. Pneumonitis, inflammation of the lung. Gastritis, inflammation of the stomach. Similarly, cystitis is inflammation of the urinary bladder because of the bacteria, because of the urinary tract infection. Infection can start from upside or from downside. Bladder is in between, no? I repeat, excretory system, kidney, ureter, bladder, urethra. Is it okay? So infection can come from kidney to the bladder or from urethra to the bladder. Very simple, no? Very simple to understand. When blood infection is there and it is affecting your kidney, the infection will go down ureter, then bladder, and bladder will be damaged. In all these cases, most of the time it is called as a urinary tract infection. Short form is UTI. I have already discussed 2 important symptoms of UTI. Can anybody tell me 2 important symptoms in the patient? No. Tell me 2 important symptoms in the patient of UTI. Please raise your hand immediately. Yes. Sit down. Anybody else can try? Yes, please. Again, the symptom is, one symptom is correct, but it is a combination of 2 symptoms. One is a burning micturition. In Marathi language it is called as unhari lagne. Most common in the summer season. Whenever you go into the urine, there is a severe burning at the urethra. You come back, again you feel to go to the toilet. You come back, burning, again you feel to go to the toilet. Only drop urine. So that is called as a burning micturition or dysuria. Whenever the dys, that is called as a prefix. Whenever dys is there, dys means difficulty. Dys means pain. Dys. So this is a dysuria. For the ladies gender, female gender, dysmenorrhea. You know, dysmenorrhea. Menorrhea means menstrual cycle. Whenever there is a pain in the abdomen, in the thighs, severe pain during the menses, during the 4 days or before the 4 days, that is a dysmenorrhea. Here we are talking about dysuria, difficulty in passing the urine, burning, micturition. And second, I had made the action previously, simple fever not there, fever with rigor. Fever with rigor, I have already mentioned in the previous lectures. There are 2 types of fever. Fever with chill, common. थोड़ी मला थंडी वाजते, I am feeling little bit cold in the fever. Fever with chill, CHILL, that is very common in every fever. But fever with rigor, like a convulsion, that is only in the 2 diseases. Can anybody tell me? Already taken this topic. 2 diseases, yes. Correct. Malaria and UTI. Say 2 diseases. Malaria and UTI, fever with rigor. Don't forget that. It is already recorded. Now we are talking about the types of bladder, and I have explained whenever there is a disease, whenever there is a trauma, whenever there is an injury, whenever there is an accident with related to the bladder or with related to the brain, with related to the spinal cord. Are you getting my point? Anywhere there is a problem, there will be problem in the micturition reflex. So all this is a pathological condition or little bit variation in the physiological. We will see one by one. Slide number 3. I am moving further. Please write down the title. S3, atonic bladder. Atonic bladder. Tone has been lost. Muscle tone is very important word. Don't forget. Muscle tone is very important word. Muscle tone is very important word in the nervous system. Oral, practical as well as theory. 100% there is a question in the examination. Tell me what is muscle tone and tell me how it is examined. I am talking about physiology practical journal. For example, this is my hand and I want to check the tone of bicep muscle. I want to check the tone of the forearm muscle. Dr. Deshpande is showing the action. What is the examination? Practical examination. Examine the tone of upper extremity. Examine the tone of lower extremity. This is the practical examination. So, 2 ways are there. 2 methods are there to examine the tone. One is just palpation. What I am doing is a palpation. I am palpating bicep and tricep and I am feeling a little bit consistency is there, little bit elasticity is there, very slight hardness is there, not too much and not too loose. Because tone has a pathology 2 ways, hypertonia and hypotonia. Hypertonia is a very stiff muscle, very hard, very stiff, that is hypertonia, and no proper consistency, that is a hypotonia. Are you looking over here? I am examining the tone of bicep muscle by palpation. I am examining the tone of forearm muscle just by palpation. This is one method. Second method, you do the movement of that muscle. For example, I want to check the forearm muscle like this, passively, and there is a little resistance. During the movement, there is a little resistance. You don't do it because you will not observe this. It is not that much easy. But only you have to remember the 2 methods. One is a palpation and second is a passive movement. If you answer in this way, you will get out mark, full marks, 10 out of 10, 5 out of 5. But 2 methods you should not forget. How to examine the muscle tone in the extremities. 2 methods discussed during the time of the bladder or the excretory system, because it is also related with the tone. But I am telling you, muscle tone is an important topic in the nervous system. I have already discussed one important topic, that is reflex in the nervous system. That is just mentioning. I am not saying I have explained, but just mentioning was there during the discussion of excretory system. This is supposed to be the, what you can say, the total holistic type of approach while teaching. If I just read out all these things, that is not a proper teaching. That is a reading of the slides. But Dr. Deshpande is never doing that way. They here also tries to connect one subject to the another subject and trying to explain the different things with relation to that topic. Maybe practical, maybe theoretical. Okay. So this is a atonic bladder number 1. Now dictation starts. Slide number 3. Why this atonic bladder is there? Write down cause. Destruction of sensory nerve fibers. Destruction of sensory nerve fibers. You remember these fibers are going to the spinal cord after filling the bladder. So they are damaged. Sensory nerve fibers are damaged. Comma. Also loss of tone in detrusor muscle. Loss of tone in the detrusor muscle. Okay. Then further, slide number 4. Okay. You write down the effect. What is the effect of that thing? Overflow incontinence. What is the effect? Overflow incontinence. I am going to explain. Don't worry about it. Overflow incontinence is a symptom, is an effect of that atonic bladder, or overflow dribbling. Overflow dribbling. This is the effect. Slide number 4. I have completed the dictation. Now just listen what I am telling. We have already learned the micturition reflex. When the bladder is full, the signal should start. Sensory nerve fibers should go to the spinal cord. Spinal cord should give signal to the intersphincters and afterward external sphincters. Here everything has been damaged. So the spinal cord is not understanding whether the bladder is full or not. And every organ, physiologically, it has its own capacity. No? The simple example is our full-fledged filling of our damp in the society. You know the river, you know the damp, no? So when the damp is having some limit, it is full, it is okay. But when there is a heavy rain, and that filling is going beyond capacity of that dam, you know what is happening? The dam is burst, and there will be flood in whole the nearby area. Am I right or wrong? The same thing is happening here. The signal is not going. That poor bladder try to accommodate 400, 450, 450. Come on. But after some time, after 480, after 500, top. Bursting is not actually the anatomically bursting of the bladder, but something that particular sphincters will lose the power of controlling, and naturally some leaking will start. That leaking is called as a incontinence. That means micturition without controlling by that particular person. Incontinence is without control. Please write down. Incontinence means without control, there will be overflow. Urination will start. But that urine is not passing like usual. Usual stream will not be there. How it will be? It's coming like a drop by drop. Dribbling means drop by drop. Please write down. Dribbling means drop by drop. 1, 2, 3, 4. Continuously going on. Again, this is a common problem in the old people. This is called as senile. Whenever I say the word old, please write down this word senile. S-E-N-I-L-E. Senile. S-E-N-I-L-E. Senile problem. You write down. Senile problem. What is senile problem? This word will come everywhere in the nervous system. Everywhere. Many problems are senile problem. Can anybody tell me what is the senile problem of memory? Can anybody tell me what is the senile problem of memory? To remember the things. In the old people, what is the problem? What is the disease? What is the name of the disease? Please, no, please tell me directly. Try it, no problem. Yes. Alzheimer is the correct answer in one way. Because Alzheimer is the last stage of but basically dementia. D-E-M-E-N-T-I. Dementia means loss of memory, not remembering. Most of the time that is senile problem. Look at me. Now I am doing some action. What is sir is doing? Moving his right hand. What is this called as? Please raise your hand. What is this? Please raise your hand. What is this? Doctor, come on. What is this? This is tremor. Tremor. T-R-E-M-O-R. Tremor. And tremor is most of the times senile problem. So are you getting my word? Senile? Senile is a problem of old people. Senile word is related with the old people. Another word in the medical language, geriatric problem. Please write down geriatric. You will not listen it from the other teachers. I am sure about it. Geriatric. G-E-R-I. Geriatric. A-T-R-I-C. Geriatric problem, senile problem, problem of the old people, common words. Common words are there. Okay, so you have understood what is the effect of the atonic bladder. Now, I have forgotten to tell you the causes. You write down all these causes. One is old age. Please write down the causes. Pathology I have described. The sensory nerve has damage. But what is the basic cause? One is old age. Number one, infection. Comma. Number three, trauma. T-R-A-U-M-A. Comma, injury. Comma, accident. Anything can be there for this damage, atonic bladder. Now, sir is moving on the slide number 5. Don't write anything, just I will tell you. Condition of the destruction of the sensory nerve fibers, they have given the two direct examples. One is a spinal injury, just now I have written spinal injury. Simple things. The person has been collapsed from the upstairs. Senior citizen is climbing the upstairs and by chance he's slipped his leg. What will happen? He will fall down from the upstairs. So falling from the upstairs will cause the spinal injury. Commonest cause of injury to the old people. Anybody knows about general knowledge? Most of the cases of fracture of the hip joint. Don't forget, fracture of the right hip joint or fracture of the left hip joint. 90% at the age of 70, at the age of 80, at the age of 90. These people, they get the fracture and within 8 days after admission in the ICU, they pass away. This is the very dangerous fracture of pelvic bone or the femur bone. This is very dangerous fracture. Sometimes they get replacement of the hip joint, etc., etc. But what is the main cause? In the old people, when they are taking their bath or when they are going for the bathrooms, when they use the bathroom, still many flats or many houses, they have the bathroom with the slippery type of the flooring. But the latest, when you do the latest construction building, everybody, new generation, they are aware of this. And they say there is some different types of the tiles, not non-skidding tile. Am I right? Non-skidding type of the tiles. That is the best thing that you can do for the old people. Also you do some bar adjustment. Still rods should be there to hold while taking the bath or while doing the micturition, etc. Because old people, when they fall, that is something like an end point of their life. Because recovery is very difficult. Lot of infection chances are there, and many times the surgical procedures they get failed, or during the surgery they get the problem like embolism and they get a heart attack. So what the warning Dr. Deshpande has given while studying the problem of the bladder, you start to take the precautions of the senior citizens by proper arrangements in your house amenities. Okay? And second important disease that very interesting, you can write down the name of the disease, syphilis. Anybody knows about syphilis? S-Y-P-H-I-L-I, syphilis. Syphilis is a disease. Anybody knows? Please raise your hand. What is syphilis? No? Or you don't want to tell? You are shy. Shy. Why? Be feeling awkward. Yes, please. No, it is a simple thing. Venereal diseases. Don't be shy to understand these problems. These are the grave problems. G-R-A-V-E. Grave problems. Serious problems for your generation. Slide number 5. Don't write anything, just I will tell you. Condition of the destruction of the sensory nerve fibers, they have given the two direct examples. One is a spinal injury, just now I have written spinal injury. Simple things. The person has been collapsed from the upstairs. Senior citizen is climbing the upstairs and by chance he's slipped his leg. What will happen? He will fall down from the upstairs. So falling from the upstairs will cause the spinal injury. Commonest cause of injury to the old people, anybody knows about general knowledge? Most of the cases of fracture of the hip joint. Don't forget, fracture of the right hip joint or fracture of the left hip joint. 90% at the age of 70, at the age of 80, at the age of 90. These people, they get the fracture and within 8 days after admission in the ICU, they pass away. This is the very dangerous fracture of pelvic bone or the femur bone. This is very dangerous fracture. Sometimes they get replacement of the hip joint, etc., etc. But what is the main cause? In the old people, when they are taking their bath or when they are going for the bathrooms, when they use the bathroom, still many flats or many houses, they have the bathroom with the slippery type of the flooring. But the latest, when you do the latest construction building, everybody, new generation, they are aware of this. And they say there is some different types of the tiles, not non-skidding tile. Am I right? Non-skidding type of the tiles. That is the best thing that you can do for the old people. Also you do some bar adjustment. Still rods should be there to hold while taking the bath or while doing the micturition, etc. Because old people, when they fall, that is something like an end point of their life. Because recovery is very difficult, lot of infection chances are there, and many times the surgical procedures they get failed, or during the surgery they get the problem like embolism and they get a heart attack. So what the warning Dr. Deshpande has given while studying the problem of the bladder, you start to take the precautions of the senior citizens by proper arrangements in your house amenities. Okay? And second important disease that very interesting, you can write down the name of the disease, syphilis. Anybody knows about syphilis? Syphili, syphilis. Syphilis is a disease. Anybody knows? Please raise your hand. What is syphilis? No? Or you don't want to tell? You are shy. Shy. Why? Be feeling awkward. Yes, please. No, it is a simple thing. Venereal diseases. Don't be shy to understand these problems. These are the grave problems. Grave, grave problems, serious problems for your generation. Because this is the problem related with the sexual life. This is the problem related with your genitals. And they are very serious. Venereal disease, this word you must know. Please write down this word, venereal disease. Veneral. Venereal diseases. Venereal diseases due to the improper type of the sex. This is the infectious diseases. All diseases are infectious. You of course everybody knows the serious disease. What is the serious disease? AIDS or the HIV. Am I right? But in between there are other diseases as well. For example, one of the diseases is syphilis, second is gonorrhea, then LGV, lymphogranuloma inguinal. What I mean to say, unprotected sex is very dangerous thing. Unprotected, without condom. And what you can say, the multiple partners, these all the things are supposed to be very, very, very dangerous in your life. Some diseases can make you die. Or some diseases can make you totally disabled. One of the diseases is syphilis. In our days, olden days, this disease was very common. Nowadays, it is very well controlled because the people are aware, they go to the doctor and take the injections. Penicillin is the best injection for this disease, but penicillin injection can give the reactions to the patients. So after sensitivity dose, that injection should be given. What is the chief complaint? There is ulcers on the genitals. And ulcer on the penis as well as ulcer on the vagina. It can affect to both male and female. But most dangerous thing about this disease, it is not detected, or the patient, they just neglect it because that ulcer is non-painful. Syphilis ulcer is non-painful, and that ulcer heals automatically within month. So he is enjoying his life. Only he sees that okay, there is some problem, but he just don't tell to anybody. Don't go to any doctor, male or female, and they after some days they apply some creams etc. and they get it automatically healed. But syphilis is not cured. Only ulcer has been healed. So that syphilis has a primary syphilis, secondary syphilis, and tertiary syphilis. That means it goes inside to your body and damaging the different organs. So in the tertiary syphilis, it is damaging to your nervous system. Please write down tertiary syphilis, T-E-R-T-I-A-R-Y, tertiary syphilis, tertiary, T-E-R-T-I-R-Y, syphilis, damaging to nervous system, NS, is equal to, and that disease is called as a tabetic bladder. That disease is tabes dorsalis, but tabetic bladder. Tabetic bladder. Please write down this word, underline. Rest of the things I will discuss some another time because of the time restraint. Slide number 6, please write down the title, atomatic bladder. Atomatic bladder. Atomatic bladder is equal to, you write down, is equal to hyperactive micturition reflex. Hyperactive micturition reflex. I will tell you what is that hyperactive. Next line you write down, even if, please dictation has been started, slide number 6, even if small amount of urine is collected, even if small amount of urine is collected in the bladder, it starts reflex action. It starts reflex action. Full stop. Just wait. Now try to understand. Our limit was there, na? 300 to 400. But some people by chance, because of their bladder muscle problem, they are weak in the structure. Even 100 ml is there, reflex starts. Micturition normal, everything is normal. But he has to go to the toilet with compared to his friend or with compared to relatives more times. Are you getting my point? Only 100 ml urine is there in the bladder, but it starts the reflex because of the excessive sensitivity. This sensitivity can be compared with your normal emotional quotient. Some people are having a, what you can say, their brain is like a stone or heart is like a stone. Whatever you talk with them, whatever you slash them, they will not mind. They will just forget, okay, what Deshpande is telling. I will listen from here 1 year and throw it from the another year. So they are like a hard people. But some people are so delicate that even if I say something wrong, very harsh, they will start the tears in their eyes. So these are the two varieties. Similarly over here in the bladder, only 100 ml, but the reflex has been started and the micturition occurs. That is called as a atomatic bladder. I am just making a concise all the discussions, okay? No. Okay. Now this atomatic bladder, you write down another cause. Detailed discussion we will do in the nervous system, but the cause is first stage of spinal shock. First stage of spinal shock. First stage of spinal shock after complete transection of spinal cord. Complete transection means to cut. In the bracket you can write down to cut. Transection of spinal cord above sacral segment. Above sacral segment. Okay. So you just have a Keep this word in your mind when we will discuss, because this is a separate topic in your syllabus. What are the effects of transection of the spinal cord? If spinal cord is cut, halfway cut, full cut, what are the effects? That we will discuss after, but one of the effect is automatic bladder, because the bladder tone is lost because of the injury. Bladder tone is lost, reflex has lost because of the injury. Now, slide number 8, please write down, slide number 8, uninhibited neurogenic bladder. Uninhibited neurogenic bladder. Next line, cause, lesion in the midbrain. Lesion, lesion in the midbrain. Make an underline to the lesion. Lesion is like a pathology. Please write down. Lesion is equal to pathology. Lesion म्हणजे pathology. Lesion is pathology. Lesion is equal to pathology. Is equal to, what is pathology? There are 3-4 types of pathology. Number 1, there may be tumor. Please write down. Brain tumor, swelling, गाठ, मराठीमध्ये गाठ म्हणतो आपण त्याला, ट्यूमर may be there, comma, hemorrhage, HEMORRHAGE, hemorrhage means bleeding, hemorrhage, comma, hemorrhage, HEMORRHAGE, bleeding. Number 3, thrombosis, THROMBOSIS, that is a blood clot, thrombosis, comma, embolism, EMBOLISM, that is moving clot, moving blood clot. So these all the things, pathology, they are in short called as a lesion. Lesion may be in the cerebrum, lesion may be in the spinal cord, lesion may be in the temporal lobe. So lesion is a pathology in the brain. Is it clear? Lesion word is very important. Okay, so lesion in the brain. So next line, what is the effect? Please write down the effect. No inhibition signal is there. No inhibition signal is there. From the brain, we have already seen the 2 centers are there. One is a inhibitory and second is a facilitatory. So inhibition will be lost. Inhibition control is lost because of the damage to the brain. Is it clear? Now next, symptoms. What are the symptoms? Please write down the symptoms. Frequent and uncontrollable micturition. Frequent, varamvar, repeatedly, frequent and uncontrollable micturition. He has to run to the toilet, to the washroom very frequently, every after 15 minutes, every half an hour, every 1 hour. But during also going to the toilet, he cannot control his sphincter and there is a dropping. So his pants will be wet even till reaching to your bathroom or the washrooms. Is it clear? Frequent and also the uncontrollable. These 2 things are very important. But here the problem is in the brain. Don't forget that. Okay? So I think this is the completion of this topic of the types of bladder, and we will continue the next topic after break. So HEMORRHAGE, hemorrhage means bleeding. Hemorrhage, comma, hemorrhage, HEMORRHAGE, bleeding. Number 3, thrombosis, THROMBOSIS, that is a blood clot, thrombosis, comma, embolism, EMBOLISM, that is moving clot, moving blood clot. So these all the things, pathology, they are in short called as a lesion. Lesion may be in the cerebrum, lesion may be in the spinal cord, lesion may be in the temporal lobe. So lesion is a pathology in the brain. Is it clear? Lesion word is very important. Okay, so lesion in the brain. So next line, what is the effect? Please write down the effect. No inhibition signal is there. No inhibition signal is there. From the brain, we have already seen the 2 centers are there. One is a inhibitory and second is a facilitatory. So inhibition will be lost. Inhibition control is lost because of the damage to the brain. Is it clear? Now next, symptoms. What are the symptoms? Please write down the symptoms. continuous, sorry, not continuous, frequent and uncontrollable micturition. Frequent, varamvar, repeatedly, frequent and uncontrollable micturition. He has to run to the toilet, to the washroom very frequently, every after 15 minutes, every half an hour, every 1 hour. But during also going to the toilet, he cannot control his sphincter and there is a dropping. So his pants will be wet even till reaching to your bathroom or the washrooms. Is it clear? Frequent and also the uncontrollable. These two things are very important. But here the problem is in the brain. Don't forget that. Okay? So I think this is the completion of this topic of the types of bladder, and we will continue the next topic after break. So wait even till reaching to your bathroom or the washrooms. Is it clear? Frequent and also the uncontrollable. These two things are very important. But here the problem is in the brain. Don't forget that. Okay? So I think this is the completion of this topic of the types of bladder, and we will continue the next topic after break. So